Hey everyone, and welcome to another deep dive. Today we're tackling something that I've seen a lot of questions about lately, and honestly, it's something I wanted to understand a bit better myself. Dental fluorosis.
It's definitely one of those topics that can sound a little intimidating at first, right?
Totally.
Mm.
But like most things when it comes to health, especially our kids' health, it's not about adding more stress. It's about getting informed. And that's what we're here for. So let's just dive right in. When we say dental fluorosis, what are we even talking about? Like, is this some scary disease I need to be worried about? Should I be rushing to make a dentist appointment right now? Give it to me straight.
Okay, so first things first. Take a deep breath. It's not a disease, and it's not a sign of bad oral hygiene.
Phew. Okay. Already feeling better.
It's actually more of a cosmetic thing.
Cosmetic?
Yeah, it happens while the teeth are still forming, under the gums. What we're talking about is basically a change in the enamel, that hard outer layer of the tooth. And it's really about appearance more than anything else. We're not talking pain or discomfort or anything like that.
Okay. So not something that's going to be causing any actual problems. More like, what, just a visual thing?
Exactly. And here's where it gets interesting because we're always told fluoride is good for teeth, right?
Right. Like brush, brush, brush with fluoride toothpaste, right?
Exactly. And fluoride is super important for strong, healthy teeth. But like a lot of things in health, it's all about finding that sweet spot, that balance. When kids get too much fluoride while their teeth are still developing, that's when fluorosis can sometimes happen.
Okay. I'm starting to see where this is going. So it's kind of like you wouldn't water a tiny seedling with the fire hose.
Right.
Too much of a good thing, even if it's meant to help, can kind of backfire.
That's a great way to put it. You've got it.
So how much fluoride are we even talking about here?
Yeah.
And how do we know what's too much? Like, should I be worried?
Let's talk about that too much part because it's easy to get a little worried when you hear those words, right?
Definitely.
The good news is that most cases of fluorosis are really mild.
Oh, good.
We're talking like teeny tiny white specks or streaks on the teeth, almost like if you've ever gotten those barely there marks on a drinking glass from hard water.
Yeah, I know exactly what you mean.
It's like that. Most people wouldn't even notice them.
Oh, okay. That's reassuring.
Oh.
But you mentioned there are different, like, levels of fluorosis.
Mhm.
So how can you tell the difference between those super common, barely noticeable cases and something more, I don't know, pronounced?
You're right. There are classifications, but here's the key takeaway. Even in those rarer, more moderate cases, it's still about appearance, not about the health of the tooth itself.
Got it.
It's not causing any pain or affecting how the teeth function or anything like that.
So we're not talking cavities or anything like that.
Not at all. And to put your mind at ease even more, those more serious cases where there might be more noticeable discoloration or even pitting of the enamel, those are really uncommon, especially these days.
That's good to know. So I think this brings up a good point because when I hear fluoride, honestly, I immediately think toothpaste. But it sounds like it's not just about that, right? It feels like there's this whole hidden world of fluoride we might not even realize is out there.
You're exactly right. That's a great way to put it. And you're right, there's definitely more to the story than just toothpaste. To understand fluorosis, we've kind of got to become detectives and follow the fluoride trail.
Okay, so we're on the case. First, stop on our fluoride investigation. Where is this stuff hiding out? Besides the obvious, like, toothpaste aisle, of course.
Well, the biggest source of fluoride for most people is actually their drinking water. You might be surprised to learn that.
Really? I had no idea. So if we're trying to be mindful of our kids' intake, how do we even figure out how much fluoride is in our water?
That's a great question, and it's definitely the first step. If you're on a public water system, they usually have reports available.
Oh,
Yeah, you can often find them online, or you can call and request one.
got it. And what about those of us with well water?
Another good question. In that case, it's a good idea to get your well water tested periodically, just like you would for other minerals and things like that.
Okay.
You can usually find a certified lab, or you can even check with your local health department. They can usually point you in the right direction.
Got it. So we've got water, we've got toothpaste. Anything else lurking in the shadows that we should be aware of?
You're good at this detective work. There are also fluoride supplements, usually they're drops or chewable tablets, but those are typically only recommended in areas where the water doesn't have a lot of natural fluoride.
Ah, okay, that makes sense. I bet that's where talking to your dentist comes in handy, right?
Absolutely. They can assess your child's individual risk based on a bunch of factors,
Yeah.
like where you live, your water source, all of that. And speaking of dentists, this is another reason why those regular checkups every 6 months are so important.
Oh, yeah, for sure.
They can keep an eye on things.
So it sounds like knowing your water is key. And I imagine the amount of fluoride in toothpaste matters too, right? Like even if we have a good water source, should we still be mindful of how much toothpaste they're using?
Absolutely. You know that whole pea-sized amount thing we're always telling parents? It's not just a suggestion. And for the littlest brushers, even smaller is better. And just as important, supervised brushing time.
Yeah.
We want that fluoride working its magic on those teeth, not getting swallowed.
Makes total sense. This is where being an informed parent or caregiver really comes in handy, right?
Right.
Asking questions, doing a little research, it can make such a big difference.
Couldn't agree more. And it's funny, researching for this deep dive, it actually got me thinking, you know how we were talking about timing being so important earlier? Well, it turns out the risk of fluorosis drops significantly after the age of 8,
Really?
because that's when most permanent teeth have already formed.
Oh, interesting. So once those teeth are in, we don't have to worry as much about the amount of fluoride.
Exactly. Fluoride is still important for preventing cavities throughout your life. But that risk of affecting the enamel in that specific way, it's really concentrated during those early years when those teeth are still developing under the gums.
That is fascinating. So what happens if, despite our best efforts, we do find out our child has some degree of fluorosis?
Well, the first thing to remember is that most cases are very mild and often, honestly, barely noticeable. And remember, it's not affecting the health of the tooth, just the appearance.
Right, right. That's good to keep in mind. But I'm sure there are options if it is a concern, right? Like if it's something that's bothering them or...
Absolutely. Dentists have a few tricks up their sleeves to improve the appearance if needed.
Okay, so tell us, what can they actually do?
Well, one option is microabrasion, which is kind of a fancy way of saying they gently remove a very thin layer of enamel.
Okay.
To minimize the appearance of any discoloration.
Right.
It's a very safe and effective procedure when it's done by, a qualified professional.
And are there other options too?
There are. Another common treatment is teeth whitening, which can help blend the color of the teeth and make those spots less noticeable.
Okay, so it's kind of like evening out the canvas.
Exactly. Now, for more severe cases, there are also options like veneers or crowns. Those are more involved procedures, kind of like custom-made covers that go over the tooth.
So a bit more intense than a quick whitening treatment.
They are, but they can be great options for people who are really self-conscious about the appearance of their teeth.
This has been so insightful. It seems like knowledge really IS power when it comes to fluorosis. It really does. It sounds like even if fluorosis happens, it's often so mild and it's not even harming the tooth.
Exactly. And those treatments we talked about, those are all elective. It really boils down to personal preference. Some people choose to do nothing at all, and some people opt for a more involved treatment. So
that makes sense. You don't have to rush out and change anything unless it's something you or your child are concerned about.
Right.
It's about having all the information and making the choice that feels right.
Yeah, I couldn't agree more. It's funny, doing all this research for this deep dive got me thinking. We've been talking about fluoride and its effects on teeth, but fluoride is actually in other things we encounter every day.
Oh, really? Like what? Now you've got me curious.
Well, certain foods, for example.
Yeah.
Did you know that some types of grapes, especially commercially grown ones, can actually contain higher levels of fluoride?
Wow, I had no idea.
Yeah.
That's surprising.
Right, and even some medications have fluoride as an ingredient. Again, it's not necessarily something to be overly concerned about, but it makes you think about the bigger picture, Like, how much fluoride are we encountering on a daily basis, and what does that mean in the long run?
It's true.
Yeah.
It's like you pull on one thread, fluoride in our teeth, and it just unravels this whole web of information.
It really does.
Well, on that note, I think we've successfully navigated the mysterious and sometimes confusing waters of dental fluorosis. We've busted some myths, uncovered some of those hidden sources of fluoride, and hopefully you're walking away feeling way more confident about all of this, whether you're a parent, caregiver, or just, interested in learning more about taking care of your teeth. Because at the end of the day, it's all about making those informed choices for healthy, happy smiles. And I have a feeling our listeners are walking away with a whole toolkit of knowledge, maybe even a little spark of curiosity to explore even more. So until next time, keep those pearly whites shining bright. Thanks for joining us on this deep dive.